Hi, genuine well wishes and constructive critics. How are you and your blood today? It's activist culture, Professor S. Suresh back with altruistic enthusiasm for my 91st video on annual of publication on YouTube today, 8th October 2018. Thursday. Topic for discussion today is cardiovascular diseases, CVD shortly, types, risk factors, and preventive measures. Cardiovascular disease, CVD, is a class of diseases that involve the heart or blood vessels. CVD involves coronary artery diseases, CAD, such as angina and myocardial infarction, commonly known as heart attack. Other CVDs include stroke, heart failure, hypertensive heart disease, rheumatic heart disease, cardiomyopathy, abnormal heart rhythms, congenital heart disease, valvular heart disease, carditis, rheumatic heart disease, aortic aneurysms, peripheral artery disease, thromboembolic disease, and venous thrombosis. The underlying mechanisms vary depending on the disease. Coronary artery disease, stroke, and peripheral artery disease involve atherosclerosis. This may be caused by high blood pressure, smoking, diabetes mellitus, lack of exercise, obesity, high blood cholesterol, poor diet, and excessive alcohol consumption, among others. High blood pressure is estimated to account for approximately 13% of CVD deaths, while tobacco accounts for 9%, diabetes 6%, lack of exercise 6%, and obesity 5%. Rheumatic heart disease may follow untreated strep throat. It may It is estimated that up to 90% of CVD may be preventable. Prevention of CVD involves improving risk factors through healthy eating, exercise, avoidance of tobacco smoke, and limiting alcohol intake. Okay, most of the diseases nowadays in our present world are lifestyle diseases. CVD is a lifestyle disease. Similarly, AIDS, HIV, then diabetes uh, are really lifestyle diseases. Treating risk factors such as high blood pressure, blood lipids, and diabetes is also beneficial. Treating people who have strep throat and with antibiotics can decrease the risk of rheumatic heart disease. The use of aspirin in people who are otherwise healthy is of unclear benefit. Cardiovascular diseases are the leading cause of death worldwide, except Africa. Together, CVD resulted in 17.9 million deaths, 32.1% in 2015, up from 1.3 million, 25.2%, 25.8% in 1990. Deaths at a given age from CVD are more common and have been increasing in much of the developing world, while rates have declined in most of the developed world since the 1970s. Coronary artery disease (CAD) and stroke account for 80% of CVD deaths in males and 70% of CVD deaths in females. Most cardiovascular disease affects older adults. In the US, 11% of people between 20 and 40 have CVD, while 37% between 40 and 60, 71% of people between 60 and 80, and 85% of people over 80 have CVD. The average age of death from coronary artery disease in the developed world is around 80, while it is around 68 in the developing world. Diagnosis, diagnosis of disease typically occurs 7 to 10 years earlier in men as compared to women. There are many cardiovascular diseases involving the blood vessels. They are known as vascular diseases, coronary artery disease, also known as coronary heart disease and ischemic heart attack, heart disease, peripheral arterial disease, disease of blood vessels that supply blood to the arms and legs, cerebrovascular disease, disease of blood vessels that supply blood to the brain, includes stroke, renal artery stenosis, aortic aneurysm. There are also many cardiovascular diseases that involve the heart. Cardiomyopathy, myopathy, disease, diseases of cardiac muscle, hypertensive heart disease, diseases of the heart secondary to high blood pressure or hypertension, heart failure, a clinical syndrome caused by the inability of the heart to supply sufficient blood to the tissues To meet the metabolic requirements, pulmonary heart disease, a failure of the right side of the heart with the respiratory system involvement, cardiac dyspneas, abnormalities of heart rhythm, inflammatory heart diseases, endocarditis, inflammation of the inner layer of the heart, the endocardium, structures most commonly used are the heart valves, inflammatory cardiomegaly, myocarditis, inflammation of the myocardium, the muscular part of the heart caused most often by viral infection and less often by bacterial infections, certain medications, toxins, and autoimmune disorders. It is characterized in part by infiltration of the heart by lymphocyte and monocyte types of white blood cells. Use eosinophilic myocarditis, inflammation of the myocardium caused by pathologically activated eosinophilic white blood cells disorder. This disorder differs from myocarditis in its causes and treatments. Valvular heart disease, congenital heart disease, heart structural malformations existing at birth, rheumatic heart disease, heart muscles and valves damage due to rheumatic fever caused by Streptococcus pyogenes, a group A streptococcal infection. There are many risk factors for heart diseases: age, gender. I don't know why they call it as sex. Tobacco use, physical inactivity, excessive alcohol consumption, unhealthy diet, obesity, genetic predisposition, family history of cardiovascular disease, raised blood pressure, hypertension, raised blood sugar, diabetes mellitus, raised blood cholesterol, hyperlipidemia, undiagnosed celiac disease, psychosocial factors, poverty and low education status, and air pollution. While the individual contribution of each risk factor varies between different communities or ethnic groups, the overall contribution of these risk factors is very consistent. Some of these risk factors, such as age, gender, or family history, genetic predisposition, are immutable. However, many important cardiovascular risk factors are modifiable by lifestyle change, social change, drug treatment, for example, prevention of hypertension, hyperlipidemia, and diabetes. People with obesity are at increased risk of atherosclerosis of the coronary arteries. Genetic factors influence the development of cardiovascular disease in men who are less than 55 years old and in women who are less than 65 years old. Cardiovascular disease in a person's parents increases the risk by threefold. Multiple single nucleotide polymorphisms (SNP) have been found to be associated with cardiovascular disease in genetic association studies, but usually the individual influence is small, and genetic contributions to cardiovascular disease are poorly understood. Age is the most important risk factors in developing cardiovascular or heart diseases, with approximately a tripling of risk with each decade of life. Coronary fatty streaks can begin to form in adolescence. It is estimated that 82% of people who die of coronary artery disease are 60 and older. Simultaneously, the risk of stroke doubles every decade after age 55. Multiple explanations are proposed to explain why age increases the risk of cardiovascular heart diseases or heart disease. One of them relates to serum cholesterol level. In most populations, the serum total cholesterol level increases as age increases. In men, this increase levels of around age 45 to 50 years. In women, the increase continues sharply until age 60 to 65 years. Aging is also associated with changes in the mechanical and structural properties of the vascular wall, which leads to the loss of arterial elasticity and the reduced arterial compliance and may subsequently lead to coronary artery disease. Men are at a greater risk of heart disease than premenopausal women. Once past menopause, it has been argued that the women's risk is similar to the man's, although more recent data from the WHO World Health Organization and the United Nations UN disputes this. If a female has diabetes, she is more likely to develop heart disease than a male with diabetes. It's all based on combo. Coronary heart diseases are 2 to 5 times more common among middle-aged men than women. In a study done by the WHO, World Health Organization, sex contributes approximately 40% of the variation in sex ratios of the coronary heart disease mortality. Sex in the sense gender again. It as gender. Another study reports similar results finding that gender differences on usage explains nearly half the risk associated with cardiovascular diseases. One of the proposed explanations for gender differences in cardiovascular diseases is hormonal difference. Among women, estrogen is a predominant sex hormone. Estrogen may have protective effects on glucose metabolism and hemostatic system and may have direct effect in improving endothelial cell function. The production of estrogen decreases after menopause, and this may change the female lipid metabolism toward a more atherogenic form by decreasing the HDL cholesterol, high density lipoprotein level, while increasing LDL, low density lipoprotein, and total cholesterol levels. Among men and women, there are differences in body weight, height, body fat distribution, heart rate, stroke volume, and arterial compliance. In the even men have andropause, similar to menopause. In the very early age-related artery pulsatility and stiffness is more pronounced among women than men. This may be caused by the women's smaller body size and arterial dimensions, which are independent of menopause. Cigarettes are the major form of smoke tobacco. Risks to health from tobacco use result not only from direct consumption of tobacco but also from exposure to secondhand smoke. Approximately 10% of CVD is attributed to smoking. However, people who could quit smoking by age 30 have almost as low a risk of death as never smokers. Insufficient physical activity defined as less than 5 times 30 minutes of moderate activity per week or less than 3 times 20 minutes of vigorous activity per week is currently the fourth leading risk factor for mortality worldwide. In 2008, 31.3% of adults aged 15 or older, 28.2% of men, and 34.4% of women were insufficiently physically active. The risk of ischemic heart disease, ischemic, ischemic, okay, and diabetes mellitus is reduced by almost a third in adults who participate in 150 minutes of moderate physical activity each week or equivalent. In addition, physical activity assists weight loss and improves blood glucose level control, blood pressure, lipid profile, and insulin sensitivity. One has to measure the BMI, body mass index, which is a ratio of weight in kg divided by height in meter square. And different countries have different norms on these things. So what is considered as obese in one country is considered as severely obese in another country. It all varies. That's why I'm not quoting it. In addition, physical activity assists weight loss and improves blood glucose control, blood pressure, lipid profile, and insulin sensitivity. These effects may at least in part explain the cardiovascular benefits. High dietary intakes of saturated fat, trans fats, and salt. Salt increases blood pressure, and low intake of fruits, vegetables, and fish are linked to cardiovascular risk. Although whether all these associations indicate causes is disputed. The World Health Organization, WHO, attributes approximately 1.7 million deaths worldwide to low fruit and vegetable consumption, frequent consumption of high energy foods, junk food, such as processed foods that are high in fats and sugars, promotes obesity and may increase cardiovascular risk. Most of these processed food, especially the fried items, they are used to palm oil, which is very bad for the heart. It is a banned item in developed countries, but developing and underdeveloped countries are still using it. The amount of dietary salt consumed may also be an important determinant of blood pressure levels and overall cardiovascular risk. Similarly, drinking this soda is very bad for the health. It's what is an anti-appetizer, leads to obesity, has plenty of carbon dioxide, which is very bad for the health. You'll only bloat up like a balloon drinking all these soft drinks, sodas. Real fruit drink is okay, but not these soft drinks, chips, the amount of dietary salt consumed. These are all Western practices which are spread to developing countries and underdeveloped countries. The amount of dietary salt consumed may also be an important determinant of blood pressure levels and cardiovascular and overall cardiovascular risk. There is moderate quality evidence that reducing saturated fat intake for at least 2 years reduces the risk of cardiovascular disease. High trans fat intake has adverse effects on blood lipids and circulating inflammatory markers, and elimination of trans fat from diets has been widely advocated. In 2018, the WHO estimated that trans fats were the cause of more than 500,000 deaths per year. There is evidence that higher consumption of sugar is associated with higher blood pressure and unfavorable blood lipids, and sugar intake also increases the risk of diabetes mellitus. High consumption of processed meats is associated with an increased risk of cardiovascular disease. Anything processed is bad. You have to go for unprocessed one, especially organics, possibly in part due to increased dietary salt intake. The relationship between alcohol consumption and cardiovascular disease is complex and may depend on the amount of alcohol consumed. There is a direct relationship between high levels of drinking alcohol and cardiovascular disease. Drinking at low levels without episodes of heavy drinking may be associated with a reduced risk of cardiovascular disease, but there is evidence that associations between moderate alcohol consumption and protection from stroke are non-causal. At the population level, the health risks of drinking alcohol exceed any potential benefits. Untreated celiac disease can cause the development of many types of cardiovascular diseases. Most of which improve or resolve with a gluten-free diet and intestinal healing. However, delays in recognition and diagnosis of celiac disease can cause irreversible heart damage. Sleep disorders such as sleep disordered breathing and insomnia, as well as particularly short duration of sleep or particularly long duration of sleep, have been found to be associated with a higher cardiometabolic risk. Cardiovascular disease affects low and middle income countries even more than high income countries. Policies that have resulted in increased socioeconomic inequalities have been associated with greater subsequent socioeconomic differences in cardiovascular disease, implying a cause and effect relationship. Psychosocial factors, environmental exposures, health behaviors, and healthcare access and quality contribute to socioeconomic differentials in cardiovascular disease. The Commission on Social Determinants of Health recommended that more equal distributions of power, wealth, education, housing, environmental factors, nutrition, and healthcare were needed to address inequalities in cardiovascular disease and non-communicable diseases. Particulate matter (PM) has been studied for its short and long-term exposure effects on cardiovascular disease. Currently, airborne particles under 2.5 micrometers in diameter (PM 2.5) are the major focus in which gradients are used to determine CVD risk. Overall, long-term PM exposure increased rate of atherosclerosis and inflammation. In regards to short-term exposure, 2 hours, every 25 microgram per meter cube of PM 2.5 per cubic meter of PM 2.5 resulted in 48% decrease of CVD mortality rate. In addition, after only 5 days of exposure, a rise in systolic 2.5 mm mercury and diastolic 2.7 mm mercury blood pressure occurred for every 10.5 microgram per cubic meter of PM 2.5. Other research has implicated PM 2.5 is irregular heart rhythm, reduced heart rate variability, decreased vagal tone, and most notable heart failure. PM 2.5 is also linked to carotid artery thickening and increased risk of acute myocardial infarction. We are talking about PM 2.5 in India. Delhi is the capital of India, where PM 10 is very high. PM 10 is much larger in size. They measure the air quality index. The air quality index is worst. The capital of the country, Delhi. People are not able to breathe. Even healthy people develop breathing problems once they go to Delhi. It's because of the mainly because of the farmers burning the farm stubble. They think it's an easy way of disposing the stubble. Instead of burning the stubble, if they cut it and feed it to the cattle, cattle will also benefit. Government is also not taking any action on these things. They are only talking about these things. Okay, age, gender, smoking, blood pressure, blood lipids, and diabetes are important predictors of future cardiovascular disease in people who are not known to have CVD. These measures and sometimes others may be combined into composite risk scores to estimate an individual's future risk of CVD. Numerous risk scores exist, although the respective methods are debated. Other diagnostic tests and biomarkers remain under evaluation, but currently these lack clear-cut evidence to support the routine use. They include family history, coronary artery calcification score, high sensitivity, C-reactive protein, ankle brachial pressure index, lipoprotein subclasses, and particle concentration. Lipoprotein A, apolipoproteins A1 and B, fibrinogen, white blood cell count, homocysteine, N-terminal pro B type, natriuretic peptide, and markers of kidney function. High blood phosphorus is also linked to an increased risk. There is evidence that mental health problems, in particular depression and traumatic stress, are linked to cardiovascular diseases. Whereas mental health problems are known to be associated with the risk factors for cardiovascular diseases such as smoking, poor diet, and a sedentary lifestyle, these factors alone do not explain the increased risk of cardiovascular diseases seen in depression, stress, and anxiety. Moreover, post-traumatic stress disorder (PTSD) is independently associated with the increased risk for incident coronary heart disease even after adjusting for depression and other covariates. Little is known about the relationship between work and cardiovascular disease, but links have been established between certain toxins, extreme heat and cold, exposure to tobacco smoke, and mental health concerns such as stress and depression. 2015 SBU report looking at non-chemical factors found an association for those with mentally stressful work with a lack of control over their working situation with an effort-reward imbalance who experience low social support at work, who experience injustice or experience insufficient opportunities for personal development, or those who experience job insecurity, those who work late night schedules or have long working weeks, those who are exposed to noise. Specifically, the risk of stroke was also increased by exposure to ionizing radiation. Hypertension develops more often in those who experience job strain and worse shift work. Differences between women and men in risk are small. However, men risk suffering and dying of heart attacks or stroke twice as often as women during working life. A 2017 SBU report found evidence that workplace exposure to silica dust, engine exhaust, or welding fumes is associated with heart disease. Associations also exist for exposure to arsenic, benzopyrenes, lead, dynamite, carbon disulfide, carbon monoxide, metal working fluids, and occupational exposure to tobacco smoke. Working with electrolytic production of aluminum or the production of paper when the sulfate pulping process is used is associated with the heart disease. Chemicals. An association was also found between heart disease and exposure to compounds which are no longer permitted in certain work environments such as phenoxyacids containing TCDD, dioxin, or asbestos. These are banned substances in developed countries. Workplace exposure to silica dust or asbestos is associated with the pulmonary heart disease. There is evidence that workplace exposure to lead, carbon disulfide, phenoxyacids containing TCDD, as well as working in an environment where aluminum is being electrolytically produced, is associated with a stroke. As of 2017, evidence suggests that certain leukemia-associated mutations in blood cancer, may also lead to increased risk of cardiovascular disease. Several large-scale research projects looking at human genetic data have found a robust link between the presence of these mutations, a condition known as clonal hematopoiesis, and cardiovascular disease-related incidence and mortality. Radiation treatments, RT for cancer, can increase the risk of heart disease and death, as observed in previous breast RT regimens. Therapeutic radiation increases the risk of a subsequent cardiovascular event, heart attack or stroke, by 1.5 to 4 times the normal rate. The increase is dose dependent, related to RT's dose, strength, volume, and location. Cardiovascular late side effects have been termed radiation-induced heart disease (RIHD) and radiation-induced vascular disease (RIVD). Symptoms are low dose dependent and include cardiomyopathy, myocardial fibrosis, valvular heart disease, coronary heart disease, heart arrhythmia, and peripheral artery disease. Radiation-induced fibrosis, vascular cell damage, and oxidative stress can lead to these and other late side effect symptoms. Population-based studies show that atherosclerosis, the major precursor of cardiovascular disease, begins in childhood. The pathobiological determinants of atherosclerosis in youth (PDAY) study demonstrated that initial intimal lesions appear in all the arteries, and more than half of the right coronary arteries of youths between 7 to 9 years. This is extremely important considering that 1 in 3 people die from complications attributable to atherosclerosis. In order to stem the tide, education and awareness of cardiovascular disease poses the greatest risk, and measures to prevent or reverse the disease must be taken. Obesity and diabetes mellitus are often linked to cardiovascular disease, as are a history of chronic kidney disease and hypercholesterolemia. In fact, cardiovascular disease is the most life-threatening of the diabetic complications, and diabetics are 2 to 4-fold more likely to die of cardiovascular-related causes than non-diabetics. Up to 90% of cardiovascular disease may be preventable if established risk factors are avoided. Currently, practice measures to prevent cardiovascular diseases include reduction in consumption of saturated fat. There is moderate quality evidence that reducing the proportion of saturated fat in the diet and replacing it with unsaturated fats or carbohydrates over a period of at least 2 years leads to a reduction in the risk of cardiovascular disease. Stopping smoking and avoidance of secondhand smoke. Stopping smoking reduces the risk by about 35%. Maintain a healthy diet, such as the Mediterranean diet. Dietary inventions. Yeah, talking about diet, we study about all that in school. The food pyramid and all that. But how many of us follow that in practice? Even I don't follow. I openly admit. Dietary interventions are effective in reducing cardiovascular risk factors over a year, but the longer term effects of such interventions and the impact on cardiovascular disease events is uncertain. At least 150 minutes, 2 hours, and 30 minutes of moderate exercise per week. Limit alcohol consumption to the recommended daily limits. People who moderately consume alcoholic drinks have a 25 to 30% lower risk of cardiovascular disease. However, people who are genetically predisposed to consume less alcohol have lower rates of cardiovascular disease, suggesting that alcohol itself may not be protective. Excessive alcohol intake increases the risk of cardiovascular disease, and consumption of alcohol is associated with increased risk of a cardiovascular event in the day following consumption. Lower blood pressure, if elevated, a 10 millimeter mercury reduction in blood pressure reduces the risk by about 20%. Decreased non-HDL cholesterol, that is LDL cholesterol. LDL cholesterol should be low, HDL cholesterol should be high. And totally both put together, I think it should be around 200. Statin treatment reduces cardiovascular mortality by 31%. Decreased body fat if overweight or obese. The effect of weight loss is often difficult to distinguish from dietary change, and evidence of weight reducing diets is limited. In observational studies of people with severe obesity, weight loss following bariatric surgery is associated with a 46% in cardiovascular risk. Decrease psychosocial stress. This measure may be complicated by imprecise definitions of what constitutes psychosocial interventions. Mental stress-induced myocardial ischemia is associated with increased risk of heart problems in those with the previous heart disease. Severe emotional and physical stress leads to a form of heart dysfunction known as Takotsubo syndrome in some people. Stress, however, plays a relatively minor role in hypertension. Specific relaxation therapies are of unclear benefit. Most guidelines recommend combining preventive strategies. A 2015 Cochrane review found some evidence that interventions aiming to reduce more than one cardiovascular risk factors may have beneficial effects on blood pressure, body mass index, BMI, and that is what I mentioned about. It is a ratio of weight in kg divided by height in meter square. That is how they decide whether the person is obese, normal, whatever, and waist circumference. However, evidence was limited, and the authors, the pot belly is also very bad. That's a sign that the person is very unhealthy. And waist circumference. However, evidence was limited with the authors. People who drink beer, a lot of beer, will have a pot belly normally. However, evidence was limited and the authors were unable to draw firm conclusions on the effects of cardiovascular events and mortality. For adults without a known diagnosis of hypertension, diabetes, hyperlipidemia, or cardiovascular disease, routine counseling to advise them to improve their diet and increase their physical activity has not been found to significantly alter behavior and thus is not recommended. Another Cochrane review suggested that simply providing people with cardiovascular risk score may reduce cardiovascular disease risk factors by a small amount compared to usual care. However, there was some uncertainty as to whether providing these scores had any effect on cardiovascular disease events. Some of these medical terms are so hard to pronounce. It is unclear whether or not dental care in those with periodontic effects affects the risk of cardiovascular disease. A diet high in fruits and vegetables decreases the risk of cardiovascular disease and death. Evidence suggests that the Mediterranean diet may improve cardiovascular outcomes. There is some also evidence that Mediterranean diet may be more effective than a low-fat diet in bringing about long-term changes to cardiovascular risk factors. The DASH diet, DASH diet, high in nuts, fish, fruits and vegetables and low in sweets, red meat and fat, has been shown to reduce blood pressure, lower total and low density lipoprotein LDL, bad cholesterol, and improve metabolic syndrome. But the long-term benefits have been questioned. A high fiber diet is associated with lower risks of cardiovascular disease. That's why I said the food should be balanced. Some amount of protein, carbohydrate, a little fat, everything is required in moderation. And the same fiber. Worldwide dietary guidelines recommend a reduction in saturated fat, and although the role of dietary fat in cardiovascular disease is complex and controversial, there is a long-standing consensus that replacing saturated fat with unsaturated fat in the diet is sound medical advice. One should keep on changing the oil, and one should never use the oil that is used for frying. It should be used only once and then it should be discarded. Total fat intake has not been found to be associated with cardiovascular risk. A 2020 systematic review found moderate quality evidence that reducing saturated fat intake for at least 2 years caused a reduction in cardiovascular events. A 2015 meta-analysis of observational studies, however, did not find a convincing association between saturated fat intake and cardiovascular disease. Variation in what is used as a substitute for saturated fat may explain some differences in findings. The benefit from replacement with polyunsaturated fats appears greatest, while replacement of saturated fats with carbohydrates does not appear to have a beneficial effect. A diet high in trans fatty acids is associated with higher rates of cardiovascular disease, and in 2015, the US Food and Drug Administration (FDA) determined that there was no longer a consensus among qualified experts that partially hydrogenated oils (PHOs), which are the primary dietary source of industrially produced trans fatty acids and genetically recognized as safe class for any use in human food. There is conflicting evidence concerning dietary supplements of omega-3 fatty acids, a type of polysaturated fat in oily fish, added to diet improves the cardiovascular risk. A 2015 Cochrane review found unclear benefit of recommending the low salt diet in people with high or normal blood pressure. In those with heart failure, after one study was left out, the rest of the trial show a trend benefit. Another review of dietary salt concluded that there is a strong evidence that the high dietary salt intake increases blood pressure and worsens hypertension, and that it increases the number of cardiovascular disease events, both as a result of the increased blood pressure and quite likely to other mechanisms. Moderate evidence was found that high salt intake increases cardiovascular mortality, and some evidence was found for an increase in overall mortality, strokes, and left ventricular hypertrophy. Blood pressures or medication reduces cardiovascular disease in people at risk, irrespective of age, a baseline level of cardiovascular risk, or baseline blood pressure. The commonly used drug regimens have similar efficacy in reducing the risk of all major cardiovascular events, although there may be differences between drugs in their ability to prevent specific outcomes. Larger reductions in blood pressure produce larger reductions in risk, and most people with high blood pressure require more than one drug to achieve adequate reduction in blood pressure. Adherence to medications is often poor, and while mobile phone text messaging has been tried to improve adherence, there is insufficient evidence that it alters secondary prevention of cardiovascular disease. Statins are effective in preventing further cardiovascular disease in people with a history of cardiovascular disease. As the event rate is higher in men than in women, the decrease in events is more easily seen in men than women. In those at risk but without a history of cardiovascular disease, primary prevention statins decrease the risk of death and combined fatal and non-fatal CVD. The benefit, however, is small. The US guideline recommends statins in those who have a 12% or greater risk of cardiovascular disease over the next 10 years. Niacin, fibrates, and CETP inhibitors, while they may increase high density lipoprotein, good cholesterol, do not affect the risk of cardiovascular disease in those who are already on statins. The combination effect is different. Fibrates lower the risk of cardiovascular and coronary events, but there is no evidence to suggest that they reduce all-cause mortality. Anti-diabetic medication may reduce cardiovascular risk in people with type 2 diabetes, although evidence is not conclusive. A meta-analysis in 2009, including 27,049 participants and 370 major vascular events, showed a 15% relative risk reduction in cardiovascular disease with more intensive glucose lowering over an average follow-up period of 4.4 years, but an increased risk of major hypoglycemia. Hypo is lower blood sugar. Aspirin has been found to be of only modest benefit in those at low risk of heart disease, as, as the risk of serious bleeding is almost equal to the benefit with respect to cardiovascular problems. In those at very low risk, including those over the age of 70, it is not recommended. The US Preventive Services Task Force recommends against use of aspirin for prevention in women less than 55 and men less than 45 years old. Aspirin is a blood thinner. Nobody should take the medication on their own without consulting the medical doctors. However, in those who are older, it is recommended in some individuals. The use of vasoactive agents for people with pulmonary hypertension with left heart disease or hypoxemic lung diseases may cause harm and unnecessary expense. Exercise-based cardiac rehabilitation following a heart attack reduces the risk of death from cardiovascular disease and leads to less hospitalization. There have been few high-quality studies of the benefits of exercise training in people and with increased cardiovascular risk, but no history of CVD. A systematic review estimated that inactivity is responsible for 6% of the burden of disease from coronary heart disease worldwide. The authors estimated that 121,000 deaths from coronary heart disease have been averted in Europe in 2008. The physical inactivity had been removed. A Cochrane review found some evidence that yoga is generally good for everything, has beneficial effects on blood pressure and cholesterol, but studies including in this review are of low quality. Tentative evidence suggests that home-based exercise programs may be more efficient in improving exercise adherence. One has to stick to the exercise also. Should be continuous. While a healthy diet is beneficial, the effect of antioxidant supplementation, vitamin E, vitamin C, etc., or vitamins has not been shown to protect against cardiovascular disease and in some cases may possibly result in harm. Mineral supplements have not been found to be useful. Niacin, a type of vitamin B3, may be an exception with a moderate decrease in the risk of cardiovascular events in those at high risk. Magnesium supplementation lowers high blood sugar in a dose-dependent manner. In a dose-dependent manner. Magnesium therapy is recommended for people with ventricular arrhythmia. Ventricular arrhythmia associated with torsilis V points who present with long QT syndrome, as well as for treatment of people with digoxin intoxication-induced arrhythmias. There is no evidence to report support omega-3 fatty acid supplementation. Cardiovascular diseases are the leading cause of death worldwide and in all regions except Africa. In 2008, 30% of global death was attributed to cardiovascular disease. These things we have discussed before. It is estimated that 60% of the world's CVD burden will occur in the South Asian subcontinent, despite only accounting for 20% of the total population of the world. This may be secondary to a combination of genetic predisposition and environmental factors. Organizations such as the Indian Heart Association are working with the World Heart Federation to raise awareness about this issue. A brief review of CVD follows. CVD is a general term for conditions affecting the heart or blood vessels. It is usually associated with a buildup of fatty deposits inside the arteries, atherosclerosis, and an increased risk of blood clots. It can also be associated with damage to arteries in organs such as the brain, heart, kidneys, and eyes. CVD is one of the main causes of death and disability in the UK, but it can often largely be prevented by leading a healthy lifestyle. Coronary heart disease occurs the flow of oxygen-rich blood to the heart muscle is blocked or reduced. This puts an increased strain on the heart and can lead to angina, chest pain caused by restricted blood flow to the heart muscle, heart attacks, blood flow to the heart muscle is suddenly blocked, heart failure, heart is unable to pump blood around the body properly. A stroke is where the blood supply to part of the brain is cut off, which can cause brain damage and possibly death. It is what we call a coma state, comatose. A transient ischemic attack, TIA, or mini stroke is similar, but the blood flow to the brain is only temporarily disrupted. But the main symptoms of a stroke or TIA can be remembered with the word fast, which stands for face. F for face. The face may be drooped on one side. The person may be unable to smile, or the mouth or eye may have dropped. Arms. A for arms. The person may not be able to lift both arms and keep them there because of the arm weakness and numbness in one arm. Speech. The speech may be slurred or garbled, or they may not be able to talk at all. S for speech. T for time. Act fast and rush the patient to hospital immediately. It is called as the golden hour. Peripheral arterial disease occurs when there is a blockage in the arteries to the limbs, usually the legs. This can cause dull or cramping leg pain, which is worse when walking and gets better with the rest. Hair loss on the legs and feet numbness or weakness in the legs, persistent ulcers, open sores on the feet and legs. Aortic diseases are a group of conditions affecting the aorta. This is the largest blood vessel in the body, which carries blood from the heart to the rest of the body. One of the most common aortic disease is the aortic aneurysm, where the aorta becomes weakened and bulges outwards. This does not usually have any symptoms, but there is a chance it could burst and cause life-threatening bleeding. Main risk factors for CVD are high blood pressure, diabetes, smoking, physical inactivity, high cholesterol, being overweight or obese, family history of CVD, ethnic background, age, gender, diet, alcohol. CVD affects many people in middle age, very often severely limiting the income and savings of affected individuals and their families. Lost earnings and out-of-pocket healthcare payments undermine the socio-economic development of communities and nations. CVD plays a heavy burden on the economies of countries. An estimated 17 million people died from CVD in the year 2005, representing 30%, 30 of all global deaths. Of these deaths, 7.2 million were due to heart attacks and 5.7 million due to stroke. About 80% of these deaths occurred in low and middle income countries. If current trends are allowed to continue by the year 2030, an estimated 23.6 million people will die from CVD, mainly from heart attacks and strokes. Examples of population-wide interventions that can be implemented include comprehensive tobacco control policies, taxation to reduce the intake of foods that are high in fat, sugar, and salt, junk food, building, walking, and cycle. Building walking and cycle ways to increase physical activity and providing healthy school meals to children. In addition, effective and inexpensive medication is available to treat nearly all CVD. After a heart attack or stroke, the risk of recurrence or death can be substantially lowered with a combination of lifestyle changes and drugs. Statins to lower cholesterol levels, drugs to lower blood pressure, and aspirin. Aspirin is a blood thinner, as I said. There is a need for increased government investment through national programs aimed at prevention and control of CVDs and other chronic diseases. Prevention is better than cure, hence focus should be on prevention by the individuals as well as the nations. Secondhand or passive smoking is equally harmful as active smoking, first-time smoking, real smokers. Ban products like tobacco products, alcohol, high cholesterol food products, junk food basically. Ban all junk food like sodas, French fry, burgers, pizzas. All these Western food is very bad for the health. Chips, fried chips, Lays. Besides, the rule should be made stringent to punish the guilty, especially business corporations polluting the environment in all possible ways without any concern for the sentient species on Earth. Government should launch mass awareness campaigns on life-threatening diseases like CVD, cancer, TB, pandemics, epidemics, and HIV/AIDS, etc. Public should also realize that one should never risk their life for little pleasures like that last only a short duration, like smoking, drinking. Debates, discussion on open-ended topics like this can go on forever. Anyhow, let me pull the plug here. We'll meet again real soon with another interesting topic. Some of the statements by views expressed are solely mine based on limited knowledge gained over 6 decades of versatile experience. Always watch these videos with closed captions, subtitles for absolute 100% comprehension. As per my sincere recommendation, zillion times so far. I know I rushed through to complete the presentation in 20 minutes maximum. It's not possible nowadays. Nowadays, I take twice or 3 times that time. It's a norm that I expect myself to retain the viewer's attention as a norm. I know nowadays I exceed this time limit since I make honest attempts to cover the selected topic more elaborately, including so many intricate fine details referring a wide variety of sources, in particular Wikipedia quite extensively. Besides, articles and books published recently. Besides, of course, I sprinkle my own salt and pepper and season it with my personal experiences so far in life and also intuition. Stay at home as much as possible to maintain social distancing, attributed to pandemic novel COVID-19 and prolong your lifespan, lead a healthy life. God alone can put a stop to natural and unnatural events, maybe bio-war and cyber-war events like pandemics, which may lead to apocalypse and extinction of all sentient species on Earth for no fault of theirs. Rest in peace and harmony.